How does newborn screening find genetic mutations for CF? How does newborn screening find genetic mutations for cystic fibrosis? This important process helps identify infants who may have this condition early on. Newborn screening for cystic fibrosis is a two-step method that focuses on detecting mutations in the cystic fibrosis transmembrane conductance regulator gene, commonly known as the CFTR gene. The first step involves measuring the level of immunoreactive trypsinogen, or IRT, in a small blood sample taken from the baby's heel shortly after birth. IRT is a protein produced by the pancreas, and elevated levels can indicate the possibility of cystic fibrosis. If the IRT level is higher than a specific threshold, a second test is performed on the same blood sample. This test looks for specific mutations in the CFTR gene. The genetic test typically screens for a panel of the most common mutations known to cause cystic fibrosis. The exact mutations tested can vary depending on the state or screening program, but many programs include the 23 mutations recommended by the American College of Medical Genetics, along with additional mutations to enhance detection. When the genetic test identifies one or two mutations in the CFTR gene, the newborn is considered screen positive. This means they will be referred for further diagnostic evaluation at a cystic fibrosis care center. It is important to understand that having one mutation often means the baby is a carrier and may not show any symptoms of cystic fibrosis. However, if two mutations are found, this is more indicative of having the condition. Newborn screening does have a relatively high false positive rate. This means that many infants flagged by the screening may not actually have cystic fibrosis but could be carriers instead. This is why it is essential to follow up with confirmatory diagnostic tests and clinical evaluations after a positive screening result. In summary, newborn screening finds genetic mutations for cystic fibrosis by first measuring elevated IRT levels in a blood sample. If the IRT is high, the sample is then tested for common CFTR gene mutations. This two-step approach allows for early identification of infants at risk for cystic fibrosis while minimizing unnecessary follow-up for those unlikely to have the condition. Always consult healthcare professionals for personalized medical advice and further information.